and welcome. You're watching the Health Talk session by Yashoda Hospitals. Back pain is a universal experience. Almost everyone has it at some point, and it can be quite difficult, causing disability. Fortunately, it often gets better on its own, but sometimes the pain can increase slowly and steadily, often requiring medical attention. So let's discuss about back pain in our today's episode. I'm Dr. Lakshmi, and let's welcome Dr. BSV Raju, Consultant Neuro and Spine Surgeon from Yashoda Hospitals, Somajiguda. Welcome to the program, Doctor.
Hi.
So, Doctor, statistics reveal that 80% of people have experienced lower back pain in their lifetime without being aware of it. So, this condition has suddenly emerged as the new epidemic. So, what do you have to say about this?
As you rightly told, the back pain is the commonest complaint a patient reaches a doctor, and the reason why it has been because of the lifestyle changes. That is, like, you tend to sit for a long time. The back is not made to sit for a long time. You have a lot of inactivity because you don't try to exercise much. You build on weight, so you lose your muscle power, muscle strength, and you try to, when you're sitting for long hours or driving for long hours, you don't try to maintain a right posture. So more than 95% of the times, very many times, whatever the pain we get are basically related to our lifestyle diseases.
I'm sure not all pain is a sudden aftermath of minor or major injury. So what are some of the common conditions which cause back pain in different age groups, Doctor?
So back pain is relatively uncommon in children, but because of the, as I told you, because of the lifestyle changes, they tend to sit for long hours and they tend to use a lot of electronic things for long hours. You tend to see that back pain or neck pain even in younger people. Whereas in the middle-aged population, maybe starting from 20 years to 50 years, the commonest cause is a positional back pain or a muscular back pain because of the bad posture or muscle weakness you get about. Apart from this, the common thing which has been persistent very many times required to reach a doctor is because of a lumbar disc prolapse or a cervical disc prolapse. In elder people, very many times the disease is basically because of severe spondylotic changes. Because of this changes related to the degeneration, very many times the disc slips out. It's called as a lumbar disc prolapse or a cervical disc prolapse. Together with this, aging changes lead to new bone formation called as osteophytes, and these osteophytes can narrow the spinal canal. So after 70 years or maybe 65 years, lumbar canal stenosis or a cervical canal stenosis, where the space available for the spinal cord is very less, is increasingly common.
But usually, don't you think that back pain is ignored by many people, thinking it to be a sign of turning old, and that can prove to be costly later? So when do you think one should seek medical attention for this, Doctor?
Yeah, it is very rightly said. Back pain is so common that we very many times we tend to overlook it. So any pain that lasts more than 3 to 4 weeks, acute pain we call them as something like less than 4 to 6 weeks. Any pain that lasts more than 4 to 6 weeks, it is persistent, then is the time possibly you need to seek a doctor. Similarly, a back pain which is increasing in severity, not coming down, and associated with radiation of the pain from the lower back to legs, are associated with other neurological symptoms like weakness in the limbs or numbness, or sometimes bladder disturbances, or back pain associated with any of the other symptoms like loss of weight, loss of appetite, or those kind of the times we need to see a doctor immediately. These are real red flags.
As you rightly said, that it's no mystery that bad posture can harm your spine. So what is a good posture while working or sitting that you recommend?
So the right way is, like, you need to make sure that the back is well supported by the back and the feet are firmly on the ground. Let's suppose you are not able to reach the floor because you are short, or otherwise you can use a footstool so that the feet are firmly on the ground and the thigh should be parallel to the floor. Similarly, the arm should be supported by your armrest. So what is happening there is your body weight is supported by the back, arms and legs. This is called as a 5-point sitting. So the right way to sit is wherein the weight of the body is supported by your backrest, armrest and as well as footrest.
So now discussing about the treatment part, the usual go-to treatment for back pain is medical, but in some cases surgical intervention is also required. So when do you think surgical intervention is considered?
Yeah, surgery is rarely required in back pain. More than 99% of the patients, they get better on their own, maybe aided by some physiotherapy, some medications. Surgeries may be required when somebody is not getting better, or a period of maybe few weeks or a few months ideally. And people who have a weakness or numbness in the legs, that means they're showing compression of the neurological elements. So back pain severe enough, not improving or couple of months, associated with weakness of the limbs, bowel bladder disturbances, these are real patients who are ideally requiring a surgery, failing which they stand a chance of losing their power, sensation and a bowel bladder control.
In the current scenario, non-invasive techniques is the way. So what are the recent advancements in this field, doctor?
So very many times now the spine surgery has become very patient friendly, and very many times you can do it on a daycare or at the most a day of hospitalization. So in people who are not getting better, very many times who are not interested in surgery, we give a nerve block. Very many times the nerve block helps to take care of your leg pain better than the back pain. So in people who are not getting better even after a nerve block, then there may be a candidates for other kind of a treatments. See, the another minimally invasive technique is called as a percutaneous ablation of a disc. I use a technique called as a laser, wherein with laser you try to ablate the disc. This itself will take away your back pain and leg pain, especially the compression is mild to moderate or to some extent severe. So this procedure takes around 30 to 40 minutes, and the entire procedure done under local anesthesia. In people who are very apprehensive or little bit having a less pain tolerance or having severe pain, we can give a minimal sedation or sometimes what we call a conscious sedation. So at the end of the day, patient goes home in a couple of hours with a band-aid, and they can start back walking in the same day. Within couple of weeks they can resume their normal activities. So other technique, standard thing is called as a microdiscectomy. In microdiscectomy, by incision of around 4 to 5 centimeters, we remove what is the loose fragment of the disc which is coming about. The procedure takes about an hour, and the patient stays in the hospital for a day, and they can be able to walk back home at the same time, and they should be able to walk back to the washroom on the same day.
I think that's amazing because spine surgeries somehow are visualized to be invasive, scaring most of the people. So what measures do you think patients should follow after surgery in the recovery period?
Yeah, in laser discectomy, as I told you, is a percutaneous procedure. Just like we put a needle which is around 19 gauge or 20 gauge needle. So they'll have some pain at the puncture site or on the back side. They should be able to resume back and take care of everything on their own in the same day itself. In a normal spine surgery, most patients as I told you, a discectomy, they can go to the washroom after 4 to 6 hours once they come out of the anesthesia, and they should be able to take care of most of the things by themselves. In a matter of 1 to 2 weeks, they should be able to walk back and do most of the things at home. Driving is a personal choice. Some people can drive back in a couple of weeks. Very many people, they would like to take rest and start doing after 2 to 3 months. Anywhere between 4 to 6 weeks is a very comfortable time to drive, to start driving back or anything. When you start driving, you make sure that you don't apply sudden brakes, no jerky drives. Make sure that you go at a normal pace, not with a speeding or anything. At the same time, when you are trying to start increasing your driving time gradually. Don't go for a long drive directly. Start with 5 to 10 minutes of drive, maybe from work, your office to somewhere else, and test yourself, test your back, however comfortable.
So it's now time to bust few myths and know the facts. Taking the first one, like some diseases, back pain also runs in the family.
It's a definite no, but what can run in the family is some habits, lifestyle diseases, lifestyle habits. They basically like inactivity, obesity, and those kind of things can run in the families rather than a back pain running in the families.
Taking the next one, weather conditions cannot affect the back pain.
Yeah, very many times people in cold weather they feel pain, like even the joint pains or back pains, everything is felt more during the cold weather. In hot climates they feel much better.
The next one, post surgery, the disability increases and the success rate is low.
No, it's a definitive no. After back surgery, the success rates are as big as 95% plus. So the risk, in short, the risks are very little because of the present available techniques of and as well as the advances in available in the science.
And taking the last one, spending additional time in the gym over the weekends is good for the spine.
Yes, definitely. Anything you work on yourself is definitely an investment for you and your back health. But at the same time, whatever exercise is being done in the gym, it should be guided and it should be gradually increased and supervised by the trainer.
So in general, doctor, back pain is considered to be the problem for older generation. So are there any special factors that you consider while treating them?
Yeah, back pain in fact is the commonest in elderly people because of the aging back. So the pain is very common and very many times they also require intervention because of the persistent pain or any kind of a weakness or numbness in the legs. So the surgery can be done even in these patients very comfortably, very safely, and the outcomes are as good as people and in a younger population. Only thing is we need to counsel them, control their pre-morbid factors like diabetes, hypertension, heart disease, spend the extra time in trying to convince them this is the best way to improve their quality of life, improve their ambulation. In fact, mobility is life, especially in elderly. The longer they are able to perform their work, psychologically also they will be happy, apart from being productive to themselves and their families. And we have several minimally invasive treatments in elderly people with fractured bones like vertebroplasty, wherein we try to, under local anesthesia through a needle, we pass a cement into the fractured bone so that it heals faster, it takes away the pain, it stabilizes the microfractures, and they can be made to ambulate within couple of days with a spinal brace. So similarly, in people who have a worsened fracture wherein the spine is totally collapsed, they are not in a condition wherein you pass a cement into the fractured bone, we can put screws also percutaneously without opening the entire spine. This is done under X-ray control so that entire technique is quite safe and they have less pain so that they can walk back the next day itself.
So before ending this episode, doctor, what message you would like to give to our audience out there as far as lower back pain is concerned?
Yeah, back pain, as I told you, is a protective phenomena what God has given us. So in fact, pain is a warning that's telling that something is not right. So something is not right within a couple of weeks. Definitely the best thing is to seek a doctor. As I told you, more than 95 to 99% they don't require surgery. It is the nature heals, supported by any of the doctor or physiotherapist and medication. So surgery is very rarely is seen, but people who require surgery, in case it is required, it can be done safely in the present world. It is very safe. In fact, it helps you to improve your quality of life, being productive to yourself and your family. And one important advice I would like to tell is there is no strict role for bed rest in back pain. So there is no role scientifically for bed rest. Any person who has a back pain, they can continue to perform their activities to the point of comfort and convenience. And lastly, I would like to tell you that spine surgery is a very additional boon to any of the needy patients. In fact, it improves your quality of life, being able to productive to yourself and your families. And in case it is required, there is no need to be any concern or delayed, as it greatly going to improve your quality of life. Thank you.
So now we have enough evidence to consider sitting is perhaps new smoking, and we've been discussing about lower back pain and its recent advancements in the treatments. So don't forget to join us for the next week as well. Until then, stay healthy and take care. Thank you.